striking 59% of Americans disapprove of Robert F. Kennedy Jr.'s actions as health secretary, according to a recent poll. But here's where it gets controversial. Political loyalties heavily shape these opinions. A fresh survey reveals a sharp partisan divide in how people view RFK Jr.'s performance in his health role. While many Republicans trust Kennedy as much as they trust their own doctors, Democrats and independents largely disapprove of his approach. This split highlights how deeply politics now influences public perceptions of health matters. Take, for example, former President Trump's unusual warning on September 22 about acetaminophen, the main ingredient in Tylenol. The Kaiser Family Foundation, a respected nonpartisan health policy research group, conducted a poll the day after Trump's statement to gauge public reaction. Ashley Kurzinger, KFF's Associate Director of Polling, explains, "What we see is a huge partisan divide. The poll showed that 59% of Democrats considered Trump's claims about Tylenol to be definitely false, whereas 56% of Republicans believed the claims were definitely true or probably true." It's important to clarify that no scientific evidence supports a causal link between acetaminophen use during pregnancy and autism. Yet, Trump advised pregnant women to tough it out and avoid this common pain reliever during a rare press conference last month. Meanwhile, medical professionals continue to emphasize that acetaminophen remains the safest option for managing pain or fever during pregnancy, as untreated symptoms can pose greater risks. This poll also sheds light on broader shifts in public trust toward federal health agencies and policies. The Centers for Disease Control and Prevention, CDC, for instance, has experienced a steep drop in trust, especially among Democrats. Kurzinger points out a 24% decline in confidence in the CDC's vaccine information among Democrats over just the past 2 years, coinciding with efforts by the Trump administration to roll back many CDC mandates. Historically, people have placed the highest trust in their personal doctors when seeking health advice. However, Kurzinger notes that since Robert F. Kennedy Jr.'s appointment as health secretary, party affiliation has become a stronger predictor of whom people trust for health information. Among Republicans, RFK is trusted as much as their own healthcare provider, she says, underscoring the politicization of health guidance. Despite this, Kennedy's overall approval rating remains low, with 59% of respondents, mostly Democrats and independents, expressing disapproval of his job performance. As trust in federal health institutions wanes, people are turning to vastly different sources for health information. Democrats tend to rely on professional medical organizations like the American Medical Association, ANA, and the American Academy of Pediatrics, with over 80% expressing trust in these groups. In contrast, only about half of Republicans share this trust, Kurzinger reports. What does this mean for public health? The landscape is becoming increasingly fragmented, with individuals making health decisions based on widely divergent beliefs and sources. As people turn to different information channels for their healthcare choices, partisanship is playing an ever larger role in what actions they take, Kurzinger concludes. This raises a provocative question. In an era where political identity shapes trust in health information, can we ever achieve a unified public health strategy? Or are we destined to see health decisions split along party lines? Share your thoughts. Do you agree that politics should influence health guidance, or should science stand above the fray?